Yo, what's up people? Welcome back to Intuition. Today's video is another pharmacy video with some more questions for you guys. We're going to tackle drug metabolism. Definitely an important topic if you want to do well on your upcoming NAPLEX exam. Alright, let's dive into these questions. Question number one. Question number one says, a patient who takes a long-term medication called drug L is prescribed a second medication called drug S. Drug L is primarily metabolized by the CYP3A4 enzyme, of which drug S is a known substrate. How would you expect the concentration profile of drug L to change? Okay, so this patient takes drug L, and then now she's given a second medication, drug S, which is a substrate of the same enzyme that metabolizes drug L. So how will this impact the concentration profile of drug L? Well, the answer to this question is that the concentration profile of drug L should stay the same. Now that might be surprising for some of you because you might think, well, if drug S is also a substrate of this same enzyme, then this should increase the concentration profile of drug L, because now not only do you have drug L binding to this enzyme, but you also have drug S. So drug S is also going to occupy some of these enzymes, and therefore there'll be fewer enzymes to metabolize drug L, and therefore the concentration of drug L should increase. That's what you would think, right? You have to be careful not to confuse substrate for inhibitor. So in this question, it does not say that drug S inhibits this enzyme. Drug S is merely a substrate. So that means that the performance of this enzyme is not going to be inhibited by drug S, which means that this CYP3A4 enzyme should be able to still perform the same. And therefore, the concentration of drug L should not be impacted by this drug. So the correct answer is answer choice B. It should remain the same. Okay, let's go on to question number two. All right, question number two says, a patient who is prescribed Tylenol 3 complains that the medication is not controlling her pain after undergoing dental surgery. How would you characterize this patient's ability to metabolize the drug codeine? Tylenol 3, you should know, is a mixture of Tylenol, which is acetaminophen, and codeine. Now remember, codeine is a prodrug. Codeine is metabolized by the CYP2D6 P450 enzyme to be converted from codeine into morphine, which is the active drug. So if this patient is given an adequate amount of Tylenol 3 and yet is still not controlling her pain, then that would suggest that she's a poor metabolizer of codeine. So the correct answer to this question would be answer choice D. She's a poor metabolizer. Alright, so definitely something you should know. Okay, let's move on to question number two. A 35-year-old patient who takes carbamazepine for seizures has shown to have a significant drop in the drug's half-life after 1 week of initiation. What is the best explanation for the decrease in the half-life of this drug? Now this is definitely a pharmacy question where you have to be familiar with the fact that carbamazepine is a drug that is capable of undergoing autoinduction. Autoinduction is when a drug is able to stimulate its own metabolism. So carbamazepine is a drug that's able to trigger the liver to generate more enzyme that's responsible for metabolizing the drug. And this is why the half-life of this drug will decrease after a week of initiation. The drug is going to be eliminated faster and the half-life is going to decrease. So the correct answer is once again D, autoinduction. Alright, so there you have it. I hope that this video was helpful. I hope that it provided you some good knowledge to help you prepare for your exam. If it did, go ahead and give it a like. Go ahead and leave a comment in the comment section if you have any video suggestions or if you just want to say hi. So I look forward to talking to you guys in the comments, and as always, I'll see you guys in the next one. Alright, bye-bye.